Ladies and gentlemen, please welcome the Executive Director of NACCHO and author of G Street Lion, Dr. Lamar Hasbrook.
Good morning, good morning. Welcome to day 2 of your annual meeting. So this morning I want to share my thoughts on some of NACCHO's activities during the past year and some of the opportunities going forward. So we kind of internally, we call this the state of the association, but it really just gives me an opportunity to kind of let you guys know what we've been up to. So I've organized my thoughts today into 3 buckets. The first bucket, oh, that's right, 3 buckets yesterday. Okay, I get it. Okay, you guys are a little ahead of me. All right, so the first one is I'm going to share a little bit about who we are, things that might not be intuitive. Then I want to tell you about what we do and what we hope to do better, and I'm going to spotlight just a few of our many accomplishments. And then finally, and what I'm most excited about is I want to share with you a vision going forward. All right, so who are we? So we are a team of approximately 120 or so staff based at headquarters in Washington, D.C., and that much you know. But what you may not know, and I thought it appropriate to share given the theme of this year's meeting, is just how wonderfully diverse we are at NACCHO. Our team is composed of approximately 70% women. We are racially diverse. Okay, here we go. Racially diverse, 45% white, 35% African American, about 20% Asian and other backgrounds. Educationally, more than 50% of our staff have their master's degrees, many of them in public health, and about 10% have doctorate degrees. In terms of experience, more than a third have worked directly in governmental public health. And generationally, we are 40% millennials, 40% Gen X's, and 20% boomers. All right. We consider ourselves somewhat evergreen, with many of our junior and entry-level staff contributing at NACCHO for 2 or 3 years or so, and then going on to contribute in other ways to the field, and we're very proud of being able to cultivate them along the way. So I invite you to get to know our staff during the next day and a half or so. They're wearing the black ribbons that says staff, and in fact, let me have all of NACCHO staff that's here stand up. Okay. Good. So just a subset, they represent just a subset of our team that's working every day on your behalf. So I want to thank them. As a leader for this learning association that values diversity and inclusion, I believe that there is extraordinary power across our diverse team. And every day we do our best to harness our collective talents and experiences and approaches to help you, our members, do more better. So what is it that we do? Our mission remains the same. We lead, we partner, we catalyze, and we amplify your voice. We do this by focusing on 3 broad areas: capacity building assistance, advocacy, and professional development. In the areas of capacity building assistance, NACCHO has supported and continues to support peer learning for chronic disease strategies, demonstrations, and mentorship to promote health and all policies. We continue to support accreditation, the advancement of health equity, obviously. We support awards for the Medical Reserve Corps units and preparedness capacity through our project Public Health Ready. In addition, we've made considerable strides to develop our consulting arm to help you do more better, even in those areas where grant support does not exist. In the area of advocacy, we continue to prioritize the issues and federal programs that are most relevant to local health departments. Whether it is fighting for the Prevention and Public Health Fund, resources to combat opioid epidemic, or Zika supplemental funding, if it's important to you, then it's important to us. In addition, we have amplified your voice through the mainstream media in unprecedented ways. Through our Recharge media and public relations teams, we have placed your stories, your perspectives, and your concerns in outlets that have touched tens of millions of Americans, including in the USA Today, CNN, New York Times, and some of the most influential political blogs around the Beltway in D.C. So increasingly, when the public hears from CDC and APHA regarding subjects like Ebola or opioids or Zika virus, they also hear from NACCHO. As an important destination for your professional development, NACCHO continues to build on its legacy of providing members with comprehensive educational and networking opportunities. From Survive and Thrive to Adaptive Leadership to our newly launched series of Management Essentials for Local Health Officials, we continue to engage federal and non-federal partners to assist us with addressing your training needs. The last point I'll make is that NACCHO is not a static organization, but rather a dynamic learning association. So if it's launching a new user-friendly website with a platform to facilitate virtual communities of practice, or growing this annual meeting, last year we had 1,300, this year I hear we're at about 1,200 and still counting, or planting seeds for public health philanthropy through the Foundation for the Public's Health, we will continue to evolve to serve you better. So what's the future look like? Well, local public health, this multidisciplinary practice of population health improvement specialists, it's more than a splendid profession. We need to remind ourselves, especially during these current times, that we are a field rooted in the traditions of social justice, nurtured in the bosoms of community trust, and supported historically through a social compact with the larger society, and increasingly non-traditional partners that all believe that all people, regardless of gender, language preference, racial and ethnic background, income, place of residence, station in life, deserve clean air to breathe, a water supply free of lead or other poisons, healthy, sustainable sources of food, safe and stable housing, community-oriented policing, who are more like guardians and less like soldiers, many other basic entitlements that help to ensure the conditions for health. However, the understanding of what it takes to achieve and maintain health continues to change. The greater appreciation for place-based factors and social determinants of health have led to dramatic shifts, not only in resources, but in terms of priorities and approaches. And while most of us acknowledge this changing landscape, not all of us embrace it just yet. Population health improvement, even if not universally defined, has taken center stage. Yet sadly, the population health improvement practitioner, or public health, has not. More than that, the social contract between society and local public health appears to be eroding. At best, the local health departments are undervalued. At worst, they're marginalized, downgraded during a time that requires an upgrade, as we learned yesterday. But what if we could adapt in a way that asserts our appreciable, recognizable value to the health system? What would it mean to work at the top of our profession? To be a high-achieving practitioner in a high-achieving local health department, to be a chief health strategist for our respective communities. The concept is not my own, nor is it new. It was described in a paper published just over 2 years ago, and John Auerbach and others were the authors. It describes 7 practices for chief health strategists, and I won't describe them in detail, but let me just give you a brief illustration of some of the types of evolutionary shifts that might be needed. For example, local health departments would go from being primary collectors of health data to mining and interpreting real-time, open, and alternative data sources, and packaging and visualizing that data for decision makers. They'd go from describing community health priorities to anticipating and thwarting those priorities. They go from being suffused in public health speak to becoming what I consider bilingual, have a better working understanding of the basic healthcare terminology, the business models of financing, the ROI, and the things that they really care about as we slide up to the table and try to show our value add. They'd go from an agency dependent on a shrinking government dime to an agency that also leverages resources of local businesses and philanthropy. They'd go from squeaking by using outdated business practices to using state-of-the-art business accountability and financing systems. From being behind-the-scenes unsung heroes to becoming an invaluable, go-to, media-savvy, tweeting, population health improving expert at a department with a strong brand identity. Some of you may be saying to yourself, well, my health department performs most of those functions already. If that's the case, then you're well on your way to becoming your community's chief health strategist. And others may be thinking, well, we have a long way to go and we may never get there. The fact of the matter is, each and every one of you represent a local health department that is at a different place in its evolution. And we believe that with assistance, every local health department can, if they are willing, take positive steps along the transformation continuum, thus demonstrating increased value over time, eventually becoming an invaluable asset and hopefully a chief health strategist. So from where I sit, it would be hard for me to imagine a nonprofit hospital pursuing a community benefit without engaging the chief health strategist in a significant way. Or for that matter, a local government leader drastically cutting and slashing the funding to an agency they perceive as being so vital to improving the length and the quality of lives of the residents while reducing preventable costs. Local businesses and philanthropies, I would imagine, would be far more likely to seek out active collaborations and align health campaigns with the chief health strategist in the community. I think you get my point. At NACCHO, we are absolutely committed to helping you get there. And towards this end, we are going to be relentless in doing 5 things. Number 1, continue to build on our suite of public health transformation tools to better enable you to move from acknowledging the changing landscape to embracing it and starting the process of re-envisioning your work. And you'll recall last year at this time, we showed a video to that end, just one of those tools. Number 2, we're committed to summarizing and providing guidance on ways to use the existing initiatives and frameworks and describe crosswalks where needed. So if we're talking about the chief health strategist, the practical playbook, the 3 buckets of prevention we learned about yesterday, building a culture of health, those are some of the 4 sentinel things that you should have in your toolbox and should understand as you begin to envision your future. Number 3, we're committed to continuing to engage partners on your behalf who are willing to provide resources for the development of trainings and tools to assist you on your journey of transformation. Just yesterday, we had such a visioning session. Some of you guys participated in that, sponsored by the de Beaumont Foundation, one of our partners. Number 4, we're committed to providing ongoing technical assistance in areas where we currently have capacity. So if it's adaptive leadership, media training, informatics, management essentials, policy development, just to name a few. And number 5, we're committed to promoting and disseminating your effective models for transformation so that we can facilitate shared learning and successful replication. Ladies and gentlemen, there is no question that in this time of change, there is a need for a chief health strategist. And I believe, as many of you do, that local health departments may be best poised to fill this role. To paraphrase the late Nelson Mandela, our being small does not benefit communities that we are entrusted to protect. If we don't step up, market forces will dictate that some other entity will. In fact, there's already evidence that this is occurring. It may be our colleagues in healthcare delivery, academic institutions, public health institutes, or even community-based human services organization. And maybe that's okay. But if indeed our time is now, as we heard yesterday, this is a moment for leadership. So my question to you is, if not now, then when? Thank you.